It's become the desperately sad, recurring story of coronavirus. More Black, Asian and ethnic minority healthcare workers are dying than their white counterparts. If anyone can help explain why, it's the colleagues of those who've lost their lives. In the biggest survey of its kind, we asked BAME doctors and nurses about their experiences on the COVID front line. The results are stark. They don't really care about us, says one. Another will be leaving the NHS as a result.
Things are not equal yet. Things are not equal.
Anu Agbula is a deputy sister at a mental health hospital.
If you did feel sick at the beginning of COVID-19, you were less likely to say that I don't feel well, or you're more likely to say that it's just a cough.
Why?
I think it's probably just the idea that you'd be judged. So if you was the first person to come out with a symptom, you would feel like, oh, they're going to think it's, the black woman that's brought this virus into the hospital.
Anu isn't alone. More than 2,000 BAME healthcare workers contributed to our survey, leaving more than 4,000 similar comments. What came up again and again and again was a feeling of being discriminated against, the idea that they were being disproportionately put on COVID wards. And some spoke of being told to keep quiet and carry on, and others said that they felt like they were working at the coalface, while in management it resembled snowy white peaks.
And while some might call the fact that many of the people protesting are also worst affected by COVID-19 ironic, I would like to explain that there is no irony here at all. I'm not a politician, I'm not an activist, I'm a doctor, and I'm a scientist. Some people will say, race doesn't exist. Of course race exists. Race is a real thing, the same way government or money are real things. They're social constructs, but they're important, and we agree we all know what they mean. But race does not exist biologically. There is no such thing as black on a genetic level. The genetic differences we see between people correlate very poorly with race, yet we repeatedly fall into this pseudoscientific assumption that race is scientifically important.